Good afternoon and welcome. Let's start with our top story. Prince Charles has tested positive for coronavirus. 71-year-old Prince Charles, the Prince of Wales, is the first member of the royal family to have tested positive for COVID-19. Now, the Clarence House has confirmed that Prince Charles is showing mild symptoms but remains in good health. The Duchess of Cornwall has also been tested but does not have the virus. The Clarence House has confirmed that Charles and Camilla are now self-isolating at Balmoral Castle in Scotland. Now, Mandy Clark, our London bureau chief, is joining us live for more on this. Good afternoon to you, Mandy. We have just learned that Prince Charles has tested positive for COVID-19. What is the latest?
Yes, Clarence House, which is their official spokesperson, that said that he has indeed tested. They are saying that the symptoms are mild, and despite this, he is in good health. But he is self-isolating. His wife, Camilla Parker-Bowles, has tested negative. The big concern for many will be, of course, the Queen and her husband, Prince Philip. How soon and how recent have they been in contact with Prince Charles? Because, of course, they are in the prime threatened group, which is the elderly. They are 90 years old. So that is the big question. It's unclear when he last had contact with them. And they also said it's unclear who was the person who provided that contact. Prince Charles is a dignitary. He meets lots of heads of state. So it's unclear who was the one who infected Prince Charles at this moment.
Now, Maddie, do we know who he has been in touch with? When was the last time that Prince Charles visited the Queen?
That is the big question on when he's visited the Queen. And also, he had kept a royal schedule up until very recently. So he had been in contact with many, many, many people, as he does as a function of a royal, senior royal. So he could also have come into contact with a lot of people and possibly unwittingly been a carrier as well. So there's a big question around his royal schedule. They'll be looking at that and also notifying people. So the fact that he hadn't been essentially self-isolating that recently could mean there's a much bigger spread. That is, in all likelihood, what will be happening now to find out exactly who he's been in contact with.
Now, Mandy, stay with us. We are also being joined by Andrew Whitehead, a senior journalist, live with us from London. Good afternoon to you, Andrew. Andrew, on this latest breaking news, Prince Charles has tested positive for COVID-19. Talk to us on the UK health system. Can we see this as a possible failure of the UK health system?
I don't think we can see it as a failure. We've got several thousand confirmed cases now across the UK. Prince Charles is by far the most high-profile person to have been confirmed to have the virus. He's 71, so he's over 70. He's in a more high-risk group. But the word from Clarence House, where he's based when he's in London, is that this is a mild attack of the virus, and he's in generally good health. He and his wife, the Duchess of Cornwall, who does not, it seems, have the virus, are in Balmoral. That's in the far north of Scotland, a very remote location. And so it's a very considerable distance from the Queen and the Duke of Edinburgh, who are not at Buckingham Palace in London, but in Windsor. But there are a great deal of measures in place now across the UK to prevent the transmission of the virus. Most of the UK is basically under a lockdown. I'm certainly under a lockdown, which means that people are not expected to go out to work unless they are essential workers. They can go to buy food. They can go for one exercise a day outside the home. Otherwise, they stay at home. So not as complete a lockdown as in India, but nevertheless a fairly firm lockdown.
Andrew, on that, with the lockdown allowing an hour for exercise, there's been a lot of controversy about this. It is not the most stringent of lockdowns. Could we see this as a failing? I mean, a high-profile person like Prince Charles coming into contact with somebody who has now obviously transmitted the disease to him, surely we can see some kind of failing here from the UK.
Well, he will have contracted the virus before the lockdown was announced. You could say, should the authorities here have moved earlier in having stricter regulations about people staying indoors and observing social distancing, I mean, that's up for debate. But I think the measures that are now in force have a great deal of public support. Some people are saying they should be more complete, that the exercising is a sort of a weak point in the measures. At the moment, many building and construction sites are still operating, and people are travelling to work on those sites. And some people are saying that is no longer appropriate. We may get a more stricter lockdown in the days ahead. But at the moment, this lockdown is just in really in day 2. So I think people want to see how this works and whether it has any effect at all on transmission rates before we go to something that's more severe.
Will this news, do you think, dampen the spirit of Britons?
I think it will concern many people here, but there'll be a great deal of relief that Prince Charles does not seem to be in any great danger. But I think there is a sort of spirit of resilience among many people here. Communities are banding together. The government appealed last night for 250,000 volunteers to help deliver food and medicines to those at high risk who've been asked not to leave their homes at all. And they had, as of this morning, within a few hours, 170,000 volunteers who'd come forward. So I think that is a sign that people are rising to the challenge that this virus places on them.
Will the entire royal family now be quarantined?
That I don't know. The Queen and the Duke of Edinburgh had left Buckingham Palace to Windsor a week or two back, just as a matter of abundant caution. Prince Charles, of course, and his wife are in self-isolation at Balmoral. Whether others now require to be quarantined depends on whether they've had recent contact with Prince Charles, and that at the moment we don't know.
We did see Prince Charles practicing a namaste in his most recent engagements. How could it be possible that he has now been contracted COVID-19?
Well, I'm not a medical expert and I can't be sure, but clearly proximity to others, the self-distancing guidelines are to stay at least 2 meters apart, can be a way that the virus transmits. So we just don't know from whom or on what occasion Prince Charles has picked up the virus. But of course, we all wish him well as he self-isolates in Balmoral.
Thank you very much. That's Andrew Whitehead joining us live from London for the latest on Prince Charles, who has now tested positive for COVID-19.